I want to talk to you about your thyroid symptoms like fatigue and weight gain and trouble losing weight, anxiety, depression, and brain fog, and why, even though you may be taking medication, you're still experiencing those thyroid symptoms. So, if you've been diagnosed with a hypothyroid condition, and especially if you've been diagnosed with a Hashimoto's or suspect that you may have a Hashimoto's condition and you're still experiencing these symptoms, you have to listen because your life depends on it. And I know that may sound a little overly dramatic, but stick with me for just a minute because I have a long track record and I don't make bold statements like that unless I really mean it. I'm Dr. Bryan Coker, the founder of 316 Health Solutions and creator of the 316 Jumpstart program. And I've spent the last 17 years in practice helping people to understand how to live a healthier life and to get more out of their life. I've worked with people from all walks of life in different stages of life, from teenagers to grandparents to business people to stay-at-home moms. And they've used what I've taught them to get the most out of their lives and to raise the quality of their lives to a whole new level. They've discovered a life where they can eat delicious foods without fear of gaining weight, a life that allows them to enjoy the little things, to build deep relationships with their loved ones, free from anxiety and depression, and a life free from chronic pain and misery. Many of them started out in what they described as the pits of hell and steadily worked their way into this transformation. And others were lucky enough to get started before their symptoms completely took over their lives. Now, in a minute, I'm going to share with you one of the secrets that fuels this transition, this transformation. But first, I need to warn you. There's a lot of programs out there that claim to have the answers to your thyroid problems. And you've probably seen some of them, like 3 ways to heal your leaky gut or 10 ways to reverse adrenal fatigue, and the list just goes on and on. The problem with these programs is that they usually don't offer any long-term fixes, and sometimes they're not even addressing the core issue at work. So you might feel better temporarily, but sooner or later, you're back to feeling miserable again. And sometimes they produce no results at all. So the real problem with these types of programs is that they can actually set you back months or even years in terms of your health, especially if you don't get the results that you were expecting. They can really destroy your will to try again, and sometimes doing the wrong thing can actually do long-term damage to your body. Now, these problems are all easy to avoid, and we'll get to that in just a minute. And I want you to know that I'm not interested in spreading any more bad news. In fact, I have great news because I'm seeing these amazing transformations happening, and I keep on hearing back from my patients that they're finding new ways to love life, and they're achieving new levels of joy and satisfaction in their transformation. I see the transformations, and in fact, the transformations are usually so overwhelming that I just have to sit back and praise God for the work that He's done in their lives. And that's what this video series is all about. I want to show you what's broken so that you can avoid that. It's not hard to avoid these things, as you'll see, but more importantly, I want to show you what's working so you can experience that amazing transformation and not just a temporary transformation that lasts a week or a month or even a year, but something that sticks with you for the rest of your life. I want to give you a foundation for a great life, a life where you're able to eat delicious foods without the fear of gaining weight, a life where you can build a deep relationship with your loved ones without any fear of anxiety or depression getting in the way, and also a life free from chronic pain and misery. I want you to have that quality of life that allows you to enjoy the little things and that quality of life that you deserve. So the reality is your body is under constant transformation, whether you like it or not. Everything you eat and come in contact with is having an impact on your body and determining the type of transformation that your body is undergoing. The big question is, are you going to take charge of that transformation and choose the direction of that transformation with a well-planned, proven strategy? Or are you going to use what I call the sick care plan and deal with the sick symptoms on a case-by-case basis, treating individual symptoms instead of the cause? We see this type of sick care plan in full effect in the medical system today, Whether you have a fever and they tell you to take ibuprofen, or you get diagnosed with a thyroid issue and you get prescribed Synthroid or levothyroxine, most of the time, doctors in the sick care system today are not seeking out the root cause of the symptoms. And they're very quick to jump to medication with little explanation. And what we're seeing is simply, it just doesn't work. Nearly every case, we see people getting sicker at the very best, not improving by taking drugs. The very fact that you're watching this video is proof enough that what you're doing probably isn't working. That's why you need a well-planned and proven strategy to get your life back. Then there's this other thing. I call it the case of the yabbits. Maybe you've heard of it, or maybe you know what I'm talking about. It's usually when I encounter someone who has tried so many things that they think that nothing is going to work for them. A conversation with a patient that has the yabbits might sound something like this: "Mary, you need to do this and this." To which Mary replies, "Yeah, but I've already done the paleo diet and it doesn't work." "Yes, Mary, that's great that you've tried the paleo diet. This is not the paleo diet. I want you to do something different. It will help you." "Yeah, but I've already eaten clean and I exercise like a maniac and nothing is working." "Mary, look, exercise might not be the best thing for you right now. I want you to try this." "Yeah, but..." Get the picture? So if you start more than one sentence in a row with "yeah, but," you probably have a case of the yabbits. And that is a serious condition that will hold you back from ever experiencing a meaningful transformation in your life. You have to avoid catching the yabbits, because it will absolutely cripple you from transforming your life. Instead of focusing on all the things that you've tried in the past that haven't worked, you have to focus on finding the right solution for you. And that's never going to happen if you keep hanging on to the past failures and expecting the same thing. So here's the big question. Is your transformation going to be governed by the sick care plan, where you just wait around to feel sick and get more sick, and finally you're just doing everything you can to just get by and you just push your way through the day? Or are you going to take charge of your transformation and choose the direction of that transformation with a well-planned and proven program that will give you the kind of life that you've been seeking? C.S. Lewis said, "It may be hard for an egg to turn into a bird. It would be a jolly sight harder for it to learn to fly while remaining an egg. We're like an egg at present, and you cannot go on indefinitely being just an ordinary, decent egg. We must be hatched or go bad." And the thing is, C.S. Lewis was absolutely right. We are constantly transforming. Like it or not, we have a choice to either hatch and learn to fly, or to remain where we're at and rot. And in the same mysterious and perfect way an egg turns into a bird, your body needs the entire system working together in a perfect harmony in order to regain your health and transform your life. It's not just your thyroid that's affecting your health and causing you to have these symptoms, it's the entire system. And I'm going to show you exactly what that system looks like right now. So here's how the system works. Let's say you're walking down the street and all of a sudden you start to feel cold. Your brain receives a signal from your nerve ends that you're cold and sends a command that eventually makes you warmer. The path of the signal starts as a hormone called the thyroid stimulating hormone, or TSH, which goes to the thyroid. Once TSH is at the thyroid, it stimulates an enzyme called thyroid peroxidase, or TPO. This enzyme causes a chemical reaction which creates the thyroid hormones known as T3 and T4. And here's where it all gets interesting. See, 93% of the hormone produced at this point is T4, and it's completely unusable, because the only usable form your cells can recognize is T3. So what happens to this large amount of unusable T4? Well, your body has to transport it through the bloodstream, hitching a ride on something called the thyroid binding globulin, where it's delivered to the liver, the gut, muscle, heart, and nerve tissue to be converted to the usable T3 form before being sent to do its job at the cells. 60% of the T4 to T3 conversion takes place in the liver, and another 20% of the T4 hormone is converted to usable T3 right in your gut. Hopefully, you're starting to see how all of the systems in your body work intricately together, and how important the T3 hormone is. Once T4 is converted to T3, it's able to go out into your body and do its job on the cells. In this case, it affects your metabolism and blood vessels to regulate your body temperature. Now, if all the thyroid did was regulate your body temperature, none of us would be that worried about it. The fact is, every cell in your body has thyroid hormone receptors, which means that every cell in your body needs T3 in order to function properly. In addition to needing the T3 hormone to function properly, each cell itself has to be healthy enough to respond to the hormone. Most importantly, T3 affects brain chemicals associated with happiness, comfort, concentration, patience, focus, clarity of thinking, memory, and learning, among many other things. It also plays a vital role in controlling the rate at which your body burns calories. Now, hopefully, it's starting to make sense why you're experiencing those symptoms. So, we established how important the T3 hormone is, and we've looked at how the T3 hormone is created by your body and used by your cells. Now, let's take a look at the traditional test that your doctor has probably run on you if he or she suspected that you had a thyroid condition. Typically, an MD or endocrinologist will check your TSH, T4, and T3 levels. Go ahead and pull out your recent blood work after the video and take a look at the labs that were ordered, and typically it's just going to say TSH and T4 or T3. If your TSH is higher than normal, they will diagnose you with hypothyroidism, and if it's too low, they will diagnose you with hyperthyroidism. In either case, the next step for the sick care model is to prescribe a medication that will balance out your levels. You might think that balancing out the levels is what should get rid of your symptoms, right? So I find this very interesting because when you look at what they're testing, what are they learning about your liver or gut or heart or your cells? Nothing. In fact, what do you think would happen if you had a condition like fatty liver, which affects your liver function? Do you think that that might affect the conversion of T3 hormone? Or what if you had some gut problem like a bad bacteria overgrowth, a parasite, candida, or leaky gut? Do you think that might have an effect on your T3 levels as well? To take it just a step further, imagine if your cells are inflamed, or dead, or dying. Even if the entire system were functioning perfectly up to this point, if your cells are dead or dying, or even inflamed, they won't respond to the T3 and will not be able to do its job in any way. Every cell in your body is like a little battery, and lucky for us, they're rechargeable. However, if it gets damaged, your body's ability to recharge them is diminished, and that's when you need a jump start. And we'll get deeper into that just a little bit later, but that's just the tip of the iceberg. The important thing to take away from this is that while your labs might be telling you something, they're not telling you the whole story. And pumping your body full of T4, the unusable hormone found in Synthroid or levothyroxine, is not going to fix the root cause. Therefore, it will not help you with your symptoms at all. Think about it. If you're taking Synthroid medication right now and your labs are coming back normal, then why are you still feeling miserable? That's the problem, and it's the cause of a lot of confusion. The reality is just because the labs are within so-called normal range, it doesn't mean that your body is converting the hormone to a usable form and utilizing it properly. And in my next video, I'm going to give you some of the foundational thyroid health principles that are absolutely vital to you restoring your thyroid and its support system. But first, there's one more subject that I want to cover really quickly, and that is Hashimoto's. If you've been diagnosed with hypothyroid, chances are pretty good that you also have a Hashimoto's, or you've at least heard of it. Studies have shown that 80% of women with hypothyroidism have Hashimoto's, which is actually the cause of their hypothyroidism. And in a nutshell, Hashimoto's is an autoimmune disease in which your immune system is attacking your thyroid. When I do live workshops, I always ask the audience what they're doing to treat their Hashimoto's. Usually I get a blank stare for most of the room, and then someone they'll shout out, I'm taking Synthroid, and then someone else may shout out, I'm not doing anything. My doctor says there's not really anything I can do. It's amazing that almost every time I ask that question, I get the same two answers, both of which are in no way treatments for Hashimoto's. In fact, Synthroid and levothyroxine do not do anything to help Hashimoto's, which is like a raging inferno just wreaking havoc inside your body. Hashimoto's is definitely not something you want to just leave alone and do nothing about. And there is something that can be done about it, which I will cover in the next video. Until then, I just want you to remember that there is hope, and you don't have to continue living with chronic pain, fatigue, and difficulty losing weight, anxiety, and depression. You can do it without the use of drugs and surgery or any other risky procedures. And you can do it naturally and safely and more effectively than you've ever imagined. And in my next video, I'm gonna share with you the foundational health principles that will give your body the tools that it needs in order to heal itself. Right now, I want to introduce you to Sandra. When I met Sandra, she was at the end of her rope. She came into my office just crying and sobbing uncontrollably. And really, she had just left her other doctor's office frustrated, and she was looking for answers, of course. And Sandra was suffering from chronic pain, fatigue, unexplained weight gain, swelling in her ankles, brain fog, and